see you. Always smiling and so beautiful. It's so nice. You are a moderator today and आप इतना अच्छी चीज के बारे में आज बताने वाले हो. We all are waiting to hear.
I'm trying to. I'll try.
Never
done this before.
It's very good and I'm sure you'll do good. तो हम शुरू करते हैं. It is 4 o'clock. I welcome all the participants and especially my moderator today, Mrs. Amita Gupta. Today is a very, very important webinar. It's on the adolescent health. All the young children, or we should say young adults, they have so many right. So I was saying, आज का वेबिनार बहुत इम्पोर्टेंट है क्योंकि इसमें जो हमारे यंग एडल्ट्स हैं वो बेचारे बच्चे बहुत कंफ्यूज रहते हैं कि उनको कई प्रॉब्लम्स हो रही होती हैं फिजिकल मेंटल एंड दे डोंट नो कि इसमें क्या सही है क्या गलत है क्या नॉर्मल है क्या एबनॉर्मल है और सबसे बड़ी बात है उनको ये नहीं समझ में आता कि हम किसके पास हेल्प के लिए जाएं. सो आई वुड लाइक टू से कि वी आर ऑलवेज अवेलेबल फॉर आवर एडोलेसेंट चिल्ड्रन to come and talk to us. और आज के वेबिनार में we will try कि आपके काफी सारी उलझने जो हैं वो सुलझ जाए and you come to know what all is normal and what is abnormal. Also, I would like to announce our last week's winner, Mrs. Nimani Gupta. She is the lucky draw winner for our last lucky draw, which for the webinar which was held on 21st August. Is Nimani with us? विशाल जी निमानी को आप अनम्यूट करिए.
जी मैम.
निमानी, आर यू देयर?
One second, ma'am. Nimani, ma'am, now you can speak here.
Yeah, Nimani, are you there?
Yes,
Nimani, many congratulations.
thank you, ma'am.
You are our lucky draw winner, and when you come to the clinic, you will get your gift. All right, and so now I invite our moderator, Mrs. Amita Gupta, to give you some insight about a very important problem. North India में एक बहुत common problem है जो बहुत लोगों को है जिसको हम बोलते हैं थैलेसीमिया और हम में से काफी लोगों को इस बारे में पता ही नहीं होता कि थैलेसीमिया क्या है. So I invite you, Mrs. Amita, to come and enlighten us about this problem. Welcome.
Thank you, Dr. Preeti. So I'll just
you can share your screen.
I'm taking this opportunity to spread some awareness on thalassemia. So, it is a inherited disease, and it is.
Please run your PPT first at the bottom.
Yeah, I've clicked the first slide.
Yeah, it's okay. It's okay, Vishalji.
Okay.
So it is inherited blood disorder, and we all know that the hemoglobin is responsible to carry oxygen to the whole part of our body. And what happens in this is the hemoglobin is deformed, and mostly the patients have very low hemoglobin and are anemic. So I'll translate in Hindi also. Thalassemia में hemoglobin सबका बहुत कम रहता है and patients बहुत pale होते हैं and ये ज़्यादातर it is in the Mediterranean Sea and near the equatorial regions like Asia and Middle East and Africa, and in India also we have many patients, and every year about 9,000 thalassaemic children are born, which we are not aware of. So thalassemia occurs because both the parents are carriers, and the defective genes, if a particular child is born with both the defective genes, then he becomes thalassaemic patient, And then there is 50% chances that it is the child is just a carrier, and 25% chances that the child is totally normal. So ये हमारा थैलेसीमिया कैसे होता है बच्चों में, जब पेरेंट्स के दोनों डिफेक्टिव जीन्स एक ही बच्चे में आ जाते हैं तो उस बच्चे को थैलेसीमिया हो जाता है.
अमिता बेटा अपनी स्लाइड्स आगे मूव करो.
Pardon? I'm moving the slides. Now this is one occurrence that if both the parents are healthy, all the children are healthy. But if one parent is a carrier, then there is 50% chance of healthy children and 50% chances that the children will be a carrier also. But there won't be any thalassaemic patient. But if both the parents are thalassaemic carriers, then 25% chance. Thalassemia occurs in the equatorial region of equatorial countries like Asia and Middle East and Africa. Then mostly it is found in the northern belt of India also. And about 9,000 thalassaemic children are born every year. So ये नॉर्दर्न बेल्ट में हमारे इंडिया में बहुत कॉमन है, बट किसी को पता नहीं है. Next, the parents are carriers, then there is a chance of 50% having thalassemia carrier and 25% thalassemia major, that is the patient, and 25% the healthy child. And if only one parent is a carrier, then there is 50% chances that the children are healthy or they are carriers. अब thalassemia patient के लिए the treatment is blood transfusions, which has to be given every 15 to 20 days. And because only RBCs are destroyed, so only RBCs can be transfused. It takes about 3 to 5 hours for every transfusion. And then folic acid is administered. And due to the regular blood transfusions, there is accumulation of iron in the body, which has to be extracted with the help of iron chelators. So this is the maintenance of thalassemia patients. Blood transfusion देना पड़ता है हर 15 या 20 दिन बाद. इसका मेन मेंटेनेंस यही है, बट इसकी वजह से बहुत सारी और एडिशनल प्रॉब्लम्स हो जाती हैं. हीमोग्लोबिन is usually 9 to 10 mg, and lot of other additional supplements also are required, and iron has to be omitted from the diet. The patient cannot take iron because as it is, there is iron accumulation in the body. So डाइट में भी बहुत सारी चीजें जिसमें आयरन होता है, जैसे पालक है और बहुत सारी चीजें वो अवॉइड करनी होती है. Then those who are already having thalassemia trait and they are on way to plan a family, then they have the option of prenatal diagnosis in beta thalassemia. And it takes place at around 9 to 11 weeks. And there is a needle to collect the fluid of the embryo, fetus, and then they just do the genetic analysis. And if the fetus is healthy, then the pregnancy is carried on, otherwise they have to abort the child. So it is quite painful. So the best option is to have precaution, and blood donation is very important as society also, because these patients need blood throughout the year, throughout their lives, and to maintain that we should encourage blood donation, and it is the red blood cells that is needed. So the blood can be used for various other patients also. And it's an appeal that please spread this awareness about thalassemia, because not many people know about it, though the occurrence is at large number in India. And screening should be done for all the eligible bachelors, and those who have already got married, they can get the prenatal tests done, so that we can eradicate this disease from our country forever. So Cyprus is one country which had got rid of this disease many years back by regular screening and testing done by every eligible bachelors, spinsters and all. So screening is very important. It should be mandatory actually.
Yes.
Thank you so much.
Thank you, Amrita. It was such a lovely and in such small time you have points. Really don't know why. So again, thank you, Amita. And I was just saying that actually electrophoresis is a test which every girl and boy should have when they are adolescent. In fact, ये problem आगे वाली generation में नहीं आएगी, क्योंकि आजकल newborn की testing हो रही है. पर जो बीच की generation है, जो 5 years पहले born हुए हैं, उन सब में at least they all should have their HB electrophoresis done while very blood test, और उससे हमें पता चल जाता है कि हम थैलेसेमिक हैं कि नहीं है. और अगर आप ट्रेट हो तो आपको ये पता होना चाहिए, जैसे अमिता ने बताया कि अगर आपका ओके, आपने अपने आप को आयरन से ओवर नहीं करना है, क्योंकि आयरन की बहुत सारी प्रॉब्लम्स होती हैं, जैसे हमारे मॉडरेटर मिस नीता ने बताया. सो नाउ वी टेक इट फॉरवर्ड्स. We will just share our screen and start today's remaining of presentation for the adolescent. So adolescence is a word which has been derived from adolescere. That means to grow or to mature. In everyone from child to becoming adult, जो बीच का time है उसको हम adolescent बोलते हैं या time for maturity बोलते हैं. Period of transition from childhood to adulthood. And WHO के हिसाब से it is between 10 to 19 years of age. It is a phase of life between childhood and adulthood. It lays the foundation of good health, and we experience lots of changes in our body.
Excuse me, ma'am, voice is breaking again. Can we switch off the video? I think then it will be better.
Physical changes, cognitive, that is the. So puberty, आप सुन रहा है?
Yes, ma'am. So we switch off the video. Now it's fine.
Yeah, I will keep my video off then.
Yes, ma'am. Yeah.
The average age for girls for puberty is between 10 to 12 years. Now, puberty की जो age है वो कम होती जा रही है. The reason for that is that because of a good nutrition, we achieve our जो basal weight है. Now, puberty is related to a weight or BMI of every child. Because of good nutrition and good dietary habits, our BMI, which is required for puberty, is achieved earlier, As a result, the age of puberty in girls has come down to 10 to 12 years, and in boys it is 12 to 14 years. Earlier it used to be 12 to 14 years for girls, but now usually we are seeing even at age of 8 years, the girls are getting their periods, which is not abnormal and one need not panic, but yet, yes, definitely you have to consult your gynecologist because once the periods start, the height growth gets limited. Then there are a few secondary sexual characteristics which develop with puberty. In girls, there is development of breast, pubic hair, they start appearing, axillary hair, they appear, and there is increased width and depth of the pelvis. In boys, pubic hair appear, then axillary hair appear, facial hair start appearing, body hair, they start appearing, and the voice becomes deep or the voice changes take place. At the moment, it is estimated that there are 243 million adolescents in India. 120 million adolescent girls are present in India. 39.4% of girls between ages of 15 to 18 years, they are lacking their quality education and they are totally lost about adolescent process. There are lots of adolescent health issues which affect us. Why do we need to understand the adolescent health? Because so much of changes are going place in our body. There is also sexual maturity and onset of sexual activity. The child who is becoming an adult is trying to experiment with the body and they're trying to explore their own body. And there is development of adult mental process and adult identity. The health of adolescents is important for all the parents that their adolescent child are taken proper care, and a healthy adolescent is also important for that person to become a healthy mature individual. What common mental health problems which the adolescents which face are, they are defined as the child and adolescent mental health is the capacity to achieve and maintain optimal psychological function and well-being. It is directly related to the level reached and competence achieved in psychological and social functioning. इसको अगर हम सिंप्लीफाई करें तो सिंपल लैंग्वेज में हम ये बोल सकते हैं कि अगर आपकी एडोलेसेंट मेंटल हेल्थ प्रॉपर्ली डेवलप नहीं होती है तो आप हेल्दी एडल्ट इंडिविजुअल नहीं बन पाते हैं और आपको ये सारी प्रॉब्लम्स फेस करनी पड़ सकती है कि आप स्कूल में पीछे रह सकते not able to complete to social problem one start feeling very lonely, they discuss their problems. Then drug and substance abuse starts, logical problems, they basically all this lead to personal problems. In scholastic problems, there is lack of concentration, there is lack of memory, lack of motivation for study, difficulty in learning particular subject, and difficulty in making career choices. Now, these problems, what we are trying to say are that these problems, most of the adolescents they face, but then they have to be corrected. आपको ये सोचना है कि problems हैं तो ये normal है. No, they are not normal. And if you do not take care of them at the right time, they will affect your overall development. So if you are facing these problems, it is the time that you should consult your parents. You should let them know that this is a problem happening and they will take you to a concerned counselor or the doctor. Again, what I am trying to say is that many of the adolescents develop this problem. So अगर ये problem आपको develop हो रही है तो ये कुछ unusual नहीं है, पर इसका treatment नहीं लेना is unusual. So you should talk to your family members, to your adults that you are having these problems and then get them sorted. At the same time, the family also has to take care that the child is growing and they should give a very good environment to the child. If there are alcoholic parents or financial problems or broken families, all these things, they lead to a big psychological effect on the child. So parents also have to be very careful what how they are conducting themselves in front of their children who are growing up. So adolescent mind can understand all the problems, and if you are facing any particular problem like financial problems, especially जैसे आजकल COVID है, so many families are going through financial turmoil. So you can actually take your child into confidence and can discuss with them. Secondly, sibling rivalry is a very big thing. Now, many times in a family, one child is very bright academically, the other child is not. So one should know, every kid is different. So it is not right for a parent to give example of an older child or a brighter child in front of another child and put that the second child who is not doing very good academically in depression. Because if we give the examples of an older or a younger kid or a sibling who is doing better, then the child in question, that child develops lots of depression and it compounds the problem. Secondly, the child who is not good academically may be good in so many other things. So the times are changing. It's not only your academic achievements, the other things also matter a lot. There are children going through a problem known as the anger, intolerant anger. Now, during the adolescence, so many changes are going on. Children, they become very irritable. They are not able to concentrate. They are not able to listen to you. So parents have to keep a very good demeanor. They have to be very tolerant. And instead of screaming at the children, because you realize that the children are not like small kids now. So instead of screaming at their children, they should try to talk to them when they are more submissive or they are more open to listen to you, because the children at this age, they will start arguing and the parents will not like it and the things will become very murky. So it's better if the child is not listening to you at that particular time or child is upset, just listen quietly. Just make sure that the child is not that angry that the child hurts himself or herself, and then pick up the issue later on. Now, drug and substance abuse is something which is very important that we should be aware about. And we should talk to our kids because the drugs are now available very easily. And that because of the internet and access of the child to the IT technology, it is important that we should have the quality time with our children. We should sit with them and we should make them aware about the harmful effects of these substances. Psychological problems, as I said, all the kids who are passing through the adolescence get low self-esteem. So it's a duty of the parents to make sure that these problems do not compound and to be closer to their children, so that if they are going into depression, we are able to give them counseling, we are able to take care of the counselors and prevent them from developing the suicidal tendencies. Now, I would like to invite my second speaker, Dr. Cherry, to take up the problems from here on. Thank you for your patient hearing.
Thank you, Dr. Preeti. I am Dr. Cherry, and we will go further on today's topic. The next slide is about the adolescent having the psychiatric disorders. So they are broadly classified into the emotional disorders, behavioral disorders, and the psychosis. While the other mental health problems they could be slow learner, there could be an exam of fear, school phobia, and common speech disorders. Now, what are the stages of adolescent? Now, stages of adolescent, they are divided into three parts. That is the early adolescent, middle adolescent, and the late one. So, the early adolescence, it stands between 10 to 13 years of their age, where basically there is the beginning of the sexual maturation. While the mid adolescence is another more 3 years we add to 13, that is between 14 to 16 years, where the physical changes they get completed, but now the behavioral changes they start coming up, and now these kids they relate more towards their peer group, and they have a more stronger sense of identity to prove themselves. Then the later adolescence is another 3 years more added to the 16, that is the 17 to 19 years, where these adolescent kids, they are more stable in their ideas, more settled, and can give a firm opinion about the different topics discussed with them. Now, these are the different changes which adolescent can feel through. That is the spiritual, emotional, physical, social, and the cognitive changes. Now, what is the growth and development they undergo? The physical growth being skeletal growth, where there is a secondary growth spurt during this time period, which accounts to the 25% of their adult height. While the body composition, they had increase in the weight gain to increase in the adipose tissue in the girls and the increase in the muscle mass. Now, what about the maturation of the reproductive system? There are hormonal changes and the secondary sexual characters develop. So, different hormones like FSH, LH, estradiol, they are increased in the girls, while testosterone, adrenal, and androgens are expected to increase in the boys. Now, the secondary sexual characters in the girls, it will be the breast development, pubic hairs, and development of genitalia in both the sexes. While in the boys, there could be facial development of facial hair, voice changes, or the underarm hair development. So what about the psychosocial development? In the psychosocial development, this is one of the important slides which we are seeing right now, where there will be less interest in the parental activities. The kids, they will more relate themselves to their friends. There will be intense relationship with the opposite sex friends. There would be mood swings. Increase in the need for privacy is one of the most important factor, and there will be increase in the intellectual ability. And the most important which increases is the liking to take the risk in the life. Now, what about the sexual changes? So there would be increase in the sexual desire, sexual activities will begin, and the kids are curious to know more about their own as well as the opposite gender experimentation, and they would like to try with the for the intimate relationships. Now, what are different factors which we need to know? That the adolescent, it accounts to one-fifth of the India's population, where there is high morbidity and mortality with the teenage pregnancy. Now, teenage pregnancy is something we should really focus on, and nowadays we should educate the child about the safe sex and when it should be done. About the poor understanding of the sexuality and safe sex practice, early marriage increases the population and also increases the mortality of the young girls. And there is an increased risk of sexually transmitted infections and the substance abuse. Now, these are the different lifestyles which nowadays the young adolescent kids they go through. If you can see in the first photograph on the left side, there is overexposure of the kids towards the media, and they feel more abused, seeing that they get influenced and they want to begin their life in the fast lane, use of illegal weapons, and they become a couch potato while seeing too much of the movies on the TV. Now, what are the different factors which affect the adolescent health? That is the neighbors and the community, peers, parents and the families, school, social norm, healthcare system, employers, and the fate of the communities. They really affect the need of a kid to ask for an adolescent health. And what are different objectives which you should know during this adolescent health is our aim should be to improve the nutrition of the kids, enhance mental health, improve sexual and reproductive health, prevent injuries and violence, and prevent substance misuse. Now, what are the causes of mortality in adolescent? So the main causes is the suicide, drowning, and the vehicular accidents. The other being anemia, tuberculosis, burns, and the cancer being only 6.1% of the total population. Now, what are the some of important factors for the suicides in adolescent? It could be a mental health condition, a history of any mental health condition, or a recent death of a family member or a close by friend, or could be a relationship problem, or could be access to harmful means, Or previous suicide attempts is one of the important history in an adolescent, or a history of substance abuse or physical or disability or illness. So one of the important factors nowadays is the ongoing exposure of bullying behavior at the workplace, at the hospital, at the your clinic, or even in the school also. Now, these are the different topics which are running inside the head of the adolescent they want to choose from, and they really need guidance from you as the parents, whether they go, which sports should they play, or in study, how should they excel, the relationship goals, the physical activity, and any of the subject choices and the part-time job. And they sometimes would really like to discuss about the school and the universities and the friends. The only thing that as a parent we should understand is we should give time to our kids and listen to the things they really want to share with us. Now here are the different scenes are depicted in these pictures which you might feel are happening at your home, is the kids being they are just sitting alone due to the lack of friends, or there are some the parents on fight amongst themselves not seeing what the kid is undergoing, or they are finding their own identity, own individuality, or could be conflict with the parents. They feel as if they are not able, the parents are not able to understand their thoughts and not respect them. The peer become more important, and there could be the mood changes. The questions keep on running in their minds. Why do we even exist? Now here the best friend during the adolescence become is the smoker or the alcohol intake. So we really have to keep a check on our kids about what habits they are undertaking. Now you know that 39% they suffer from the low self-esteem, and the first stage of all this thing it becomes at a early age. Yes, it's between 19 to 13 years of their age. Now the second drop is between 18 to 23 years of their age. So you really have to take care between 19 to 13 years of their age and between the 18 to 23 years of their age. Now, when life gets harder and they cannot handle it, they make wrong choices. So, as parents, really need to guide them nicely and listen to them patiently. Now, there are the different health problems which the adolescents they face. Is a problem in the school of being underperformer or being bullying and the peer pressure, or emotional problems could be anxiety disorders, depression, or the low self-esteem. Behavior changes could be substance abuse, sexual offense, or the teenage pregnancy. So peer pressure is one of the important factors which might lead the young adolescent to depression or even the suicide tendency. Or as a way, you should tell the kid how to deal with the stress. Growing up in a home where alcohol and drug abuse is considered normal behavior is also one of the important factors which might affect the mental health of an adolescent. Or coping with the death of a loved one is also important, or a teenage rebellion is quite common, which we might as parents expect from or maybe experiencing right now during our lifetime. So those with low self-esteem may abuse substances in order to boost their self-confidence. So dealing with the relationship problem is also one of the important factor. So there are tendencies in the substance abuses. Foremost thing is just saying no. No means no. Or you could make the right friends, listen to your family rules that are important as a young kid to follow. Never be afraid of asking for a help. This is one of the another important factor which you should follow. Talk to the family about your concerns and questions, and stay connected with your parents. Find a drug-free environment to excel in your future. Be someone you would look up to and learn about the consequences of the drug and the alcohol abuse. So even if you're going to a bar or you're going to a discotheque, you should be firm for what you believe, and you should say firmly to the things which you don't like and say no is no. If I don't want to drink, or if I want to smoke or use taking a drug, if you're not interested, say no. That is the only thing which will help you excel. So ahead the topic, I would like Dr. Isha to come and discuss about the nutritional problems and the other things ahead. Thank you, Dr. Cherry, for such a brief introduction to our topic. I'm Dr. Isha, and I will continue with the rest of the topic. So, coming to nutritional problems, this is the most common problem which we have seen in adolescent. क्योंकि ज़्यादातर जो adolescent हैं, they take like junk food, non-balanced diet. So, उसकी वजह से क्या हो जाता है? Anemia is the most common concern. So, there can be nutrition anemia. There can be eating disorder. Eating disorder में आता है crash diet, binge eating, anorexia और bulimia nervosa. Then obesity, vitamin deficiency, and diabetes. So anorexia nervosa, they have some warning signs. Basically, it's an age where we lose weight or gain weight. So उस time पे, if you are gaining weight and if you want to lose weight, so some they go for this eating disorder. This is basically usually you refuse to eat any type of food. Not so you are consistent to avoid situation. In a large amount of food. So basically आप बाकी चीजें avoid करते हो. एकदम से आप अगर फूड लेना स्टार्ट करते हो उसके बाद क्या करते हो आप यू जस्ट यूज सम परगेटिव्स या वॉमिटिंग करके वो सारा फूड बाहर निकाल देते हैं. उसकी वजह से इवन इफ यू आर हंग्री यू टेक दैट अमाउंट इन लार्ज क्वांटिटी. उसके बाद यू एक्सपेल दैट ऑल द फूड. उसकी वजह से यू मेंटेन दैट वेट व्हिच इज वेरी cumbersome. Coming to binge eating. बेसिकली बिंज ईटिंग सबको पता ही है. यूजुअली कभी भी हम मूवीज देखते हैं या बाहर जाते हैं फॉर गेट टुगेदर वी डू दैट बिंज ईटिंग. बट यूजुअली बिंज ईटिंग में क्या होता है यू गेन द ओबेसिटी एंड सारी लाइफस्टाइल डिसऑर्डर्स कैन हैपन. सो व्हाट इज द न्यूट्रिशनल नीड ड्यूरिंग एडोलसेंस? बेसिकली in early adolescence you should take 16,000 per day calories. In middle adolescence you should take 16 to 2,000 calories. So this is the minimum requirement for your body. इससे कम और इससे ज़्यादा can be harmful for you. Late adolescence में you can just take 2,000 calories per day. Coming to menstrual disorders. Basically जो adolescent age होती है, it is the beginning of your menses. So puberty के time पे जब menses आए हैं, that is called onset of menstruation. So with the menstrual cycle, there can be disorder which can be associated with that. So basically, these are the most frequent gynecology complaints which can affect the quality of life of adolescent and young women. So basically, आपको ये सबको पता है average length होती है days, can or more. Every day it comes in the normal range and can last 4 to 6 days. So coming to irregularities, कुछ irregularity you have all experienced that. Oligomenorrhea क्या होता है? अगर आपकी menses जो है वो कम आ रहे हैं, मतलब ज़्यादा गैप देकर आ रहे हैं. Polymenorrhea अगर वो जल्दी आ रहे हैं. Menorrhea अगर bleeding हो रही है between two. Menorrhea को excessive flow आ रहा है. You have to change your pad regularly even in 1 hour. Menorrhea is bleeding at irregular interval with increased flow. So this is the main menstrual cycle. This you can just understand for your information. So basically ovarian cycle में क्या होता है? There are two phases, follicular phase and luteal phase. इसमें जो है eggs बनते हैं और इसमें जो है egg mature होकर रख सकता है. So ये जो है these are the हमारे जो hypothalamic hormones होते हैं which release and they cause the ovulation of the egg. So ये follicle बन रहा है, यहाँ ovulation होगा, यहाँ पर जो है वो degenerate हो जाता है follicle. So this is the normal menstrual cycle. अगर जब आपको यहाँ पर क्या होगा, आपकी lining बनेगी जब ovulation होती है, और अगर pregnancy नहीं हुई है तो ये lining shed होकर menses बनकर आ जाती है. So 10 to 35% they report menorrhagia. 21 to 67% आयरन डेफिशिएंसी नहीं है. जिनको बहुत ज्यादा ब्लीडिंग होती है उनको एनीमिया होने का डर रहता है. Abstinence from work and school is cumbersome. This is very important कि आपकी जो menstrual irregularity है वो आपकी quality of life या school life को affect कर सकती है. So coming to this is the disorder of adolescence. So basically PCOS आपने सभी सुना होगा, and this is the age, the ideal age when you can get PCOS. So अगर आप अपनी
जेनेटिक, हार्मोनल और लाइफस्टाइल को मेंटेन करके रखते हैं, सो उसकी वजह से आपकी पीसीओएस के इंसिडेंस कम हो सकते हैं. सो दीज आर द मेन फैक्टर व्हिच कैन लीड टू पीसीओएस. So coming to the symptoms of PCOS, you can have irregular periods, complete secondary absence of the menses. अगर आपको menses जो है skip हो रहे हैं, periods skips हो रहे हैं, hair thinning and loss हो रहा है, abnormal skin discoloration हो रहा है over the neck, over the back, excessive facial hair हो रहे हैं, hirsutism हो रहा है आपको, blood pressure आपका high हो रहा है, weight gain हो रहा है, acne हो रहे हैं, any stress or depression. These all are the symptom of PCOS. If you are suffering from any of this, this is not the ideal situation कि आप PCOS है आपको. So you can get the hormonal checkup along with this. So according to that, you can treat. Adolescent obesity. So basically, obesity is also a factor of PCOS. So what affect the obesity? There are family factors like genetic हो सकता है, कोई hormonal, कोई environmental status, nutrition knowledge. Basically, अगर आप physical activity कम कर रहे हैं, आपका intake ज़्यादा हो रहा है, और अगर आपको कोई stress, depression है, या आप किसी भी सोशो इकोनॉमिक वर्क डिमांड की वजह से जो है आपकी ये डिमांड जो इंक्रीज हो रही है, तो दैट कैन लीड टू ओबेसिटी. सो व्हाट कैन इट कॉज impact on your health? It will increase the incidence of type 2 diabetes. It will happen in the later stage of your life. मतलब adult stage में हो सकता है, after 40s हो सकते हैं ये problem. So it's better to maintain your weight. So type 2 diabetes हो सकता है, lipid profile आपकी derange हो सकती है, cholesterol बढ़ सकता है, आपको obstructive sleep apnea हो सकता है, heart disease, hypertension, bone pain, osteoarthritis हो सकता है, any other diseases can happen with obesity. So how you can prevent it? Basically, you have to say no to junk food. You can take occasionally, but better to go for the balanced diet. Exercise कर सकते हैं, stress management, especially during the exam period, that is very important, and weight control. You should keep check on your weight. So coming to the social media. Social media has a positive and negative influence on the adolescent age. So basically, what are the negative? We all know the positive influence. I will just brief you about the negative effects. So basically, lack of interest in studies. There is an increase in demand for the money if you are involved in any games or any other activities. There is an increased risk of human harassment if you are seeing any other videos which include that thing. Influence of wrong personality, and there is increased cases of violence. So how can you prevent that? Basically, you should limit your social media. You can use, but under the guidance of your parents, and this will cause decrease in rating, depression, anxiety, and loneliness. Coming to teenage pregnancy. So basically, the safe sex practice is very important for the adolescent. They should know about the contraception option. So if there is a teenage pregnancy, what can occur? There is a stillbirth, infant death हो सकती है, preterm birth हो सकता है, अगर baby born होता है तो low birth weight हो सकता है, infant asphyxia हो सकता है. So these are the reasons you should avoid the teenage pregnancy. So these are the contraceptive pills and condom which can be used to prevent the unwanted pregnancy or teenage pregnancy. So basically, how to improve your sexual and reproductive health? First, you should not be embarrassed to talk about all the things. You should know about what you are going for. So coming to basically, you should avoid all this unwanted pregnancy by using the contraceptive method. So what is CSE? This is the comprehensive sexuality education, which helps you in understanding the female reproductive or male reproductive system. So basically इसमें क्या बताते हैं? Bodily changes जो आपकी body में होते हैं वो बताया जाता है. What likes, loves and relationship ये सारा explain किया जाता है. Sex and sexuality आपके experimentation को rule out किया जाता है. This is very important. So ये आपको school में या आप parents से बात करके you can just talk about it. So coming to this is very important. Don't embarrass yourself. Without getting embarrassed, you can just ask your queries to your parents. Coming to violence. Violence is very common among children. Like bullying is very common in schools. So basically, homicide is among top 5 cause of death in adolescents. 80% they are boys. So that is very important. You should take consideration. If you are feeling any loneliness or any bullying, you should talk to your parents or friends or relatives. So type of abuse, it can be emotional and verbal abuse, financial abuse, stalking on the web medias, physical abuse, sexual abuse, or digital abuse. So basically, you should know how to say no, and you should know the consequences of any of the things it can happen to you. So basically, you should prevent the injuries and violence. Any type of violence should be avoided. So schools are the ideal place for you to understand what is right and wrong for you. So basically, to connect more with most adults, this is the age where you make friends. So it's very important कि आप क्या आपका friend जो है वो choice जो है वो ठीक होनी चाहिए. They will teach you about the sexual health also. So they will create a healthy environment, teach you about the physical and health education, and provide you a better health facilities. So coming to, if you are facing any of these problems like swelling or ulcer in the genital area, abnormal discharge, pain or burning during maturation, severe abdominal pain, so you need a help of doctor. So coming to menstrual hygiene, it's very important. If you are even if you are suffering from all these conditions, if you are maintaining the menstrual hygiene, so you can prevent all these things. So basically, आपको sanitary pad जो हर 4 to 6 hours में change करना है, even if it is full or not. आपने discard करना है उसको sanitary pad को properly. Wash your undergarment properly. Wear clean and dry undergarment और cotton undergarments पहनने चाहिए ताकि उससे जो है ventilation proper हो and keep yourself clean. Coming to dental hygiene, dental caries is very common seen in adolescents. So to prevent that, basically dental hygiene should be maintained. Coming to self-education, so healthy mindset should be there, internet safety should be there, grooming, body image in the media, it should be enhanced. Drug and alcohol, the fact should be known. Smoking, fact should be known, it should be avoided. Healthy relationship should be avoided. Consent जो है important है for any intimate relationship, and contraception के बारे में पता होना चाहिए. Then coming to personality development, so these are the factors you should know about. Communicate properly. This will help you in building your personality and will help you in finding a good job in future. So communicate properly, good thoughts, develop new passion, improve your reading skills, learn to dress properly. You should have some leadership qualities also. Connect with your teammates and develop good sense of humor and have some confidence. Coming to nutrition diet, like I have previously told you, nutritional anemia is very common. So how can you correct that? Basically, you have to take a balanced diet. So it contains fat, carbs, protein, vitamins, mineral and fibers. So iron rich food, अगर आपको iron deficiency anemia है, तो अगर आप ये सब options ले सकते हो. They are rich in iron, or you can take iron tablet once a day. Then coming to green leafy vegetables, they will correct iron, vitamin A, calcium, folic acid deficiency. Vitamin A sources, it is good for your eyesight. So this is very important. You should include in your meal. Vitamin C sources, it is good for your skin and immunity. Citrus fruit, green vegetables, and amla servings. You should have 2 to 3 servings every 2 hours, and this is the pyramid which show you the serving, how can you take that. Coming to physical activity, is very important. अगर PCOS है आपको, तो diet plus exercise is very important. It will, even if you are reducing 10% of your body weight, it will help you in long term. Hygiene and health is very important. Always wash your hand well before and after food handling. So coming to vaccination, vaccination adolescent में very important. आपको ये पता होगा कि booster dose तो लगती है, जो tetanus का booster dose होता है, वो जो लगता है 10 और 16 years पे. HPV vaccine, it is a cancer cervix vaccination. I will tell you in detail in next slide. Influenza vaccine, it is given annually. तो एक साल बाद strain change हो जाती है, तो we give it annually. So catch-up vaccine, अगर आपको MMR कभी नहीं लगा है at the time of your young age, तो MMR ले सकते हैं. हेपेटाइटिस बी वैक्सीन, इसकी 3 डोजेस होती है, 0 to 6 months पे ले सकते हैं. टाइफाइड वैक्सीन जो एवरी 3 hours पे रिपीट करनी होती है. चिकन बग वैक्सीन एवरी 3 hours पे रिपीट करनी होती है. हेपेटाइटिस ए, एंड दिस इज द हाई रिस्क. अगर आप उस पे रह रहे हैं हाई रिस्क एरिया में, तो दिस इज द वैक्सीनेशन व्हिच शुड बी टेकन. So coming to HPV infection, जो HPV vaccine है, that cancer cervix vaccination, वो क्यों ली जाती है? Because it will prevent the cancer cervix, और cancer cervix जो होता है वो HPV infection से होता है. So basically, to prevent that HPV infection, it is very important कि आप prophylactic vaccine लें, क्योंकि वो 99.9% आपको cancer cervix से prevent करती है. So basically there are types of HPV 16 and 18. So अगर cancer cervix वो करता है, उसके साथ वो जेनिटल एनोजेनिटल वार्ड्स कर सकता है और अदर टाइप ऑफ कैंसर कर सकता है. तो HPV विल प्रोटेक्ट यू फ्रॉम डिफरेंट टाइप ऑफ कैंसर्स. So basically primary prevention में we have two vaccines, cervarix and gardasil. जो cervix है वो 2 strains पे काम करती है, but जो quadrivalent है, जो gardasil है, वो 4 स्ट्रेन के अगेंस्ट काम करती है. सो इट इज अ बेटर वैक्सीन कंपेरेटिव टू सर्विक्स. तो गार्डेसिल लेना चाहिए और इसकी डोज जो है वो 0 to 6 मंथ्स पे लगती है. एंड अगर आपकी एज 14 ईयर से कम है तो आपको सिर्फ दो डोजेस लगेंगी 0 और 6 मंथ्स में, और अगर आपकी एज जो है 15 से ज्यादा है तो आपको 3 डोजेस लगेंगे 0 to 6 मंथ्स पे. एंड हु शुडंट गेट द वैक्सीन? अगर आप प्रेग्नेंट है तो आपको वैक्सीन लेना चाहिए. अगर आप बहुत ज्यादा इल हो, सिक हो, तब भी लेना चाहिए. और अगर आपको फर्स्ट डॉक्टर रिएक्शन हो जाती है, देन यू शुड अवॉइड दैट. देन कमिंग टू फर्टिलिटी प्रिजर्वेशन एडोलेसेंट. इन केस अगर किसी भी एडोलेसेंट को कोई कैंसर डायग्नोज होता है एंड दे आर ऑन एनी कीमोथेरेपी, रेडियोथेरेपी, तो उस केस में यू कैन प्रिजर्व योर फर्टिलिटी, क्योंकि बहुत सारे कैंसर ट्रीटमेंट होती है जो कि आपके एग्स को डैमेज कर सकती है. तो फॉर दैट यू कैन जस्ट गो फॉर द एग फ्रीजिंग. तो एग फ्रीजिंग हमारे क्लिनिक में अवेलेबल है. इसमें बेसिकली क्या करते हैं, ओवरी में जो एग है वो स्टिमुलेट करके एग को रिट्राइव किया जाता है और उसको क्रायो प्रिजर्व, मतलब एक लिक्विड नाइट्रोजन पे फ्रीज कर देते हैं, और उसको हम आफ्टर ईयर्स जब भी आप प्रेग्नेंट होना चाहेंगे तो हम उसको यूज कर सकते हैं. एग को हम रिट्राइव करके फिर हम स्पर्म से फर्टिलाइज करके एक एम्ब्रो बना के देन वी कैन इम्प्लांट इन योर यूट्रस. So basically it is the age of a lifestyle disorder. So if you are avoiding that, you can avoid all these conditions: obesity, hypertension, dyslipidemia, insulin resistance, smoking. These are all problems which you can avoid. So counseling is very important in adolescent. It starts at home by parents. School में you should choose wisely. You should choose your friends. You should know about the safe intimacy. Viral status पता होना चाहिए कि आपको कोई हेपेटाइटिस या कोई भी जो है सेक्सुअल ट्रांसमिटेड डिसीज ना हो जाए, तो आपको वायरल स्टेटस पता होना चाहिए. थैलेसीमिया स्टेटस पता होना चाहिए, एज ऑलरेडी टोल्ड बाय द मॉडरेटर. सो दिस इज द सेफ्टी टिप्स व्हिच एवरी गर्ल शुड लिव बाय. सो ये सब आपकी चीजें आपके पास होनी चाहिए, एंड हैव स्टैंड अप फॉर योरसेल्फ एंड हैव सम टेक्निक फॉर द सेल्फ डिफेंस आल्सो. So this is the book which is written by Dr. Preeti Jindal, Dr. Cherry, and Dr. Smita ma'am. So this is available in our clinic, and on Amazon it is also available. So you can get this book. Basically it contains everything about the adolescent girl. So PMS के बारे में और body image, period, exam, stress, how you can deal with that, is सब available है. So you can just buy it from here or from Amazon. So it is the time that adolescent health comes of age. It is very smart investment. अपनी health में invest करते हो तो आपका जो future है वो bright रहता है. So thank you very much for all the participants who has participated in today's webinar, and we have concluded the webinar schedule for now. So I would like to thank Mrs. Amita also for such a nice moderation, and if you have any question you can just put in the chat box. Okay, so there is no questions. So thank you very much for attending today's webinar, and I hope everyone take care of yourself during this pandemic. We will meet you soon. Thank you very much. Thank you, ma'am.